Patients of IU Health who use UnitedHealthcare as their insurance may have to find another healthcare provider.
The two companies have yet to agree on a new contract, and the deadline is fast approaching. News 18's Elizabeth Rentschler has more on how failing negotiations could affect patients.
Making a change is never easy, but it's always difficult.
And a change is something Don Kopis and thousands of other Hoosiers are bracing for. IU Health and UnitedHealthcare have been unable to come to terms on a new contract which expires December 31st, leaving many patients in limbo.
Not only do we see a number of IU Health doctors, but of course this involves the IU Health hospital too. So that puts a big whammy on our entire family.
According to research firm Health Leaders Interstudy, the dispute could affect nearly 400,000 Hoosiers. Kopis says she's been a patient of IU Health for nearly 40 years and says she'd prefer not to go anywhere else.
You begin a trust, you begin a relationship with all of your doctors and specialists and even with the hospital.
If a deal isn't reached by December 31st, Kopis and others may have to switch healthcare providers. Should contract negotiations fail, staying with IU Health will mean higher out-of-pocket costs for patients, and that's something many prefer not to pay.
We would have to try to find a doctor that's covered, at least for primary care and those kinds of things, but if it gets to be specialty doctors, we'll consider what's needed at that time.
IU Health officials declined to offer News 18 a statement, but did offer this statement via email to the Indiana Business Journal. We remain optimistic that we will reach a resolution that is beneficial to both parties and the patients we serve. UnitedHealthcare officials did not return our calls for comment.
I encourage them to keep an open relationship, to keep talking about these things, because there is such a thing as trickle-down effect, and I'm part of the trickle.
Elizabeth Rentschler, News 18.